It is
Thank you.
my pleasure to introduce our practice in focus this month, Women and Infants Hospital in Rhode Island. Representing women and infants is clinical pharmacist Jenna Solomon. Jenna will speak a little bit about her practice and why she joined NCODA and how her and her team are partnering with NCODA now and how they would like to continue to partner with NCODA moving forward. Jenna.
Hi, everyone. Thank you, Stephen. So as mentioned, I do work at Women and Infants Hospital. So this is a teaching hospital of the Warren Alpert Medical School of Brown University, and we're located in Providence, Rhode Island. So to focus first on our Providence location, we have a gynecologic oncology clinic in which we are staffed with 7 gynecologic oncologists, 4 nurse practitioners, 4 gyn-onc fellows, and 1 nurse navigator. We also have a breast health center that's comprised of 3 medical oncologists, 2 breast fellows, 2 nurse navigators, 5 breast surgeons, and 1 plastic surgeon. At our main infusion site, we have a total of 10 full-time infusion and 3 per diem nurses. Also, as a part of our services, we do have palliative care embedded into our services on both the inpatient and outpatient side. We have genetic counselors, as well as a women's intimacy and sexual health clinic. In addition to our Providence location, we also have off-site infusion centers with provider offices located in Westerly, Warwick, and Fall River. As far as our mission and value, we are committed to improving the health and well-being of women and infants and to providing our essential services regardless of ability to pay. Specifically focusing on our pharmacy services, we do employ 4.5 full-time pharmacists and 2 technicians for the purpose of order verification and preparation, along with a sterile products pharmacist, 2 investigational drug services pharmacists, as well as 2 oncology pharmacy specialists, including myself. Brittany Regala is our other oncology pharmacy specialist, and she is a clinical assistant professor at UR, and Women and Infants is her practice site, where she works with the inpatient gyn-onc service, as well as the palliative care clinic. I work as an oncology pharmacist, and my focus is on outpatient oncology care, specifically with patients receiving oral chemotherapy. And to help me, I do have a pharmacy liaison. Our technician is an integral part of our team and has been here well before I started. So I started at Women and Infants in September of 2018. Since then, my focus has been standardizing the process for which oral chemotherapy patients are managed. And this is a huge part of why I joined NCODA. I was made aware of this organization through Brittany, who's actually one of the co-chairs of the OCE committee. Brittany and I both recognize the importance of NCODA's work in contributing to the development of patient resources in collaboration with HOPA, ONS, and ACCC. And so considering that my job focuses on really standardizing the process for patients receiving oral chemotherapy, I was quickly drawn to the wealth of information that's made available through this organization. As a new oncology pharmacist myself, I chose to join in order to take advantage of these resources and to also learn from the examples of many of you guys who have been in this field much longer than I have and have been able to standardize this process. And with respect to our oral chemotherapy service, while we've made some strides since I started here, we certainly have a long way to go. And one of our biggest goals is to have our own specialty pharmacy. And so I look to NCODA to help continue to provide us resources justifying the use of medically integrated dispensing services as we work towards creating a similar practice model. And we greatly appreciate the work that's been done so far, including such things as the PQIs, which I do use for niraparib, as well as many others. And I would like to be more involved with NCODA personally. I am currently a member of the OCE committee, and for the time being, I have elected to join the foundational 2nd tier just to allow myself the opportunity to get fully acclimated to my new position at Women and Infants. However, in the upcoming year, I hope to increase my involvement with the OCE committee and continue to get involved with the summits as well. And so as I look to the future, challenges that I see that I hope NCODA will help with will just be a shift towards a practice model that better accommodates our patients on oral chemotherapy. And this will be necessary as the number of FDA-approved agents continues to increase. So that's all I have, and thank you for highlighting our practice for today.
Great. Thank you again, Jenna. And for everyone listening, you can find Women and Infants Hospital Practice and Focus application available on the NCODA website under our Practice and Focus webpage. So thank you again.